something always good comes out of it. There is a silver lining, and in the fullness of time, we will see what the silver lining in this pandemic might be. We are not yet out of the woods. Indeed, it looks like we are getting more and more into the woods. The fight against disease has proven that it is a marathon rather than a sprint. As you are aware, and from our daily briefings, we have informed you that the disease is firmly rooted now within our communities. In fact, the level of spread in our villages and our estates and in our homes has become clearer from our targeted testing that was rolled out a couple of weeks ago. This means that we cannot afford to relent in this fight if we must safeguard the lives of our people. Fellow Kenyans, today we continue to combat the COVID-19 pandemic. We celebrate our partnership with Gavi. Gavi, the Global Vaccine Alliance, was founded in the year 2001, bringing together public and private sectors globally to improve access to new vaccines for children in developing countries. To date, Gavi has supported Kenya with over shillings 50 billion grant aid in the form of vaccines and 6 billion in direct cash support. The success of immunization facilitation by these assistance have led to tremendous improvement in child survival rates in our country, keeping the promise of a prosperous and healthy nation as we safeguard our children. We need to keep our children safe from killer diseases. His Excellency President Uhuru Kenyatta in 2019 took up the role of Gavi champion in support of Gavi replenishment. It is due to his commitment to immunization and improving the lives of children and his leadership in the global movement of universal health coverage that he is now championing Gavi replenishment. This afternoon, from 3 p.m., His Excellency the President will join key world leaders in the Gavi Global Summit, Vaccine Summit 2020, hosted by the Prime Minister of the United Kingdom of Great Britain, the Right Honorable Boris Johnson. His Excellency will seek to inspire greater leadership and resource allocation towards ensuring a successful replenishment of Gavi's program for 2020 to 2025 with at least a desired contribution of $7.4 billion to immunize an additional 300 million children in developing countries. Further, he will engage on the importance of accelerating local manufacturing of vaccines and access to a future COVID-19 vaccine. Lessons out of the COVID-19 pandemic have taught us the need for self-reliance, especially in the manufacturing of goods and services. And this, ladies and gentlemen, is achievable. Turning to another subject altogether, in our effort to deal with COVID-19 pandemic, the government has disbursed a conditional grant of 5 billion shillings to all 47 counties. This is aimed at bolstering the level of readiness in our health facilities, specifically for COVID-19. This money is a conditional grant divided amongst the counties in accordance with the formulas designed for them and with agreement from the Council of Governors. The reason is that it is now up to the county governments to utilize these funds to safeguard the lives of our people by ensuring that our local health facilities are well equipped and our healthcare workers are adequately catered for. If our counties are fully prepared, and have the necessary infrastructure in place, then we shall have nothing to worry about. However, we all know what happens when the reverse takes place. I would like to reiterate here that this 5 billion is a substantial amount of money. Now, this is not to replace what the government, what the health ministry has already been doing for the counties. We have been supplying PPEs, we have been supplying ventilators, we have been giving additional support to the counties, and we will continue to do so. But we felt it is important for counties to take responsibility in terms of the preparedness, particularly issues to do with the isolation facilities, issues to do with quarantine facilities, issues to do with monitoring with health workers, community health workers, training them so that they are able to take care of COVID patients even in their own homes. So what we are saying is that this is to establish a deeper, the money is there to establish a deeper relationship, a deeper understanding, a deeper association with us as we continue to fight against this pandemic. With the fight against the virus continuing, we have realized that over 80% of our patients in hospitals are asymptomatic, and therefore baby can and may be managed from home. If this is implemented, it would free our health facilities from congestion, because we are reaching, for example, in Nairobi, at a time when both Bagathi and KU are already getting to full status. The Ministry of Health is in the process of actualizing, and indeed we have already completed the process of actualizing home and community-based care protocols for rollout and to be implemented countrywide. What this means is that a lot of people who are in isolation facilities may be released to be taken care of at their homes, provided two things happen. A, it is in accordance with new World Health Organization protocols that we are still looking at and trying to customize and domesticate to our situation. Number two, it has to do with the facilities that families may have, and where no such, and where families are not able to either self-quarantine or self-isolate, the government will still assist in the process. But I would like to make it clear that a time is coming when we cannot continue as usual, that we have to change tax. Taking care of 500 people is not the same as taking care of 5,000 people. And obviously 5,000 people is a completely different ballgame from 50,000 people. We have learned over the last 3 months or so, we have been in school learning how to manage this disease, understanding this disease, going with the protocols that we were learning from other people. But now the time has come when we must also begin to implement our own systems in our own place, depending on our own environment, and because it is the only way that we can be able to cope with what we are expecting in the future. So the Ministry of Health is going to be issuing these protocols, and when they do, the most important thing will be how our citizens, how our warriors in the fight against this virus, and those warriors are our own people. It is you and I. We are the warriors against this disease. Therefore, when people come home and they are supposed to be in isolation facilities, it will call for a degree of discipline that honestly we must stick to. Because if we don't stick to that degree, we are going to have a problem. So I'm appealing to all Kenyans, as soon as this protocol is out, that when we see people coming home, we will understand two things. They are no danger to us, first and foremost. there will be no danger to us, and therefore there is no need for stigmatization. It is not necessary. You will be safe, but the people concerned will have to take care, and the families, you have to take care of them, so that they do not, because they do not need hospitalization. On that same note, my attention has once again been drawn to cross-border truck drivers. In the last few weeks, we have witnessed a large number of truck drivers at border points testing positive. Let me make it clear that all drivers take a COVID-19 test at least 48 hours before embarking on their journey and acquire a COVID-19 free certificate. We have, however, noted that a majority of the truck drivers are commencing their journey to the borders without this valid document, expecting to be tested at the border points. This has resulted to unnecessary congestion and delays that have been witnessed at our border points. This is purely indiscipline, which is unacceptable and will not be tolerated. I'm urging our law enforcement officers to take appropriate action against each such driver flaunting these measures. Na wajua tunaambia mambo mengi tukiwa hapa, habari hawa madereva. Kule port KPA, wale ambao wanaingia huko wakiwa na magari, kwa sababu tumetoa amri ya kwamba hakuna driver ambaye anaweza patiwa mzigo na gari akiwa yeye hana COVID-19 certificate. Lakini wale wanafikiri ni wajeuri sana, wanapatiana gari zao, wanaingia port na driver moja ambaye ana certificate. Anaingia ndani ya port, anatoa mzigo, akitoa mzigo kufika hapo nje, anapatia driver mwingine ambaye hajafanywa test. Huyo sasa ndio anatoka kutoka hapo, anaenda mpaka Busia. Na mimi nashangaa sana kwa sababu najiuliza, kutoka Mombasa jameni, na mimi nikitembea mimi mwenyewe nasimamishwa roadblock mengi. Huyu mtu ni kusema amepitia njia ingine ambayo haina roadblock, ama ni kusema alipitaje roadblock na anaenda mpaka Busia. Mimi sitaki kusema ati kuna kitu ama mimi sioni, lakini wewe mwenyewe jiulize. Hata ukiwa wewe sio mwelevu sana, unafikiri alipita namna gani kutoka Mombasa mpaka akafika Busia? Alifikaje huko? Na wale askari walikuwa hiyo barabara, ni hadithi gani wanaweza kutupatia vile huyo mtu alipita hiyo barabara yote? Kwa hivyo kuendelea mbele ni lazima tuanze kuuliza, kama mtu alipita saa fulani na tunajua ni askari gani walikuwa barabarani saa hiyo wakati yeye alipita, ni lazima tushughulike na hiyo maneno na kujiuliza, ulikuwa umelala? Hukuuliza kama huyu ana hii COVID certificate? Na kama hukuuliza, kwa nini hukuuliza? Yaani kuna mazungumzo hapo, si wewe unaona hivyo? Kwa sababu wengine wanafika huko border, wana certificate zao. Some people are very low adhering. Wengine wanafuata sheria. Wanaenda Mombasa, wanaenda 48 hours before, anapatiwa certificate yake, anaenda mpaka Busia, mpaka Namanga. Akifika hapo anasimamishwa hapo kwa siku mbili, kwa sababu wale ambao hawana ndio wamepanga mizigo huko mbele, wamepanga magari mbele yake, wana double park, yeye hawezi kupita. Askari wanaenda, wanamwambia si uende, wewe una certificate. Nauliza sasa mimi naedaji? Hapa mbele yangu ni magari imejaa, na wale wako hapa mbele hawana certificate. Kwa hivyo hata wewe ukiangalia unaweza ona hii ni mambo ya ile tunaita indiscipline. Hii ndio shida ambayo iko kwa boda. Iko watu wengi sana ambao wanafuata sheria hapo, madereva wazuri. Na unajua hata ukikaa hapo siku ngapi, huwezi kupita hiyo boda kwenda Uganda bila hiyo certificate. Vile vile tuna shida pande ya Tanzania. Na tunasema hivyo. Lakini upande wa Tanzania mambo ni ingine hiyo sasa, ni hadithi zingine. Ni stories zingine hizo ambao tunasema ukija lazima utoe certificate. Na ukiwa huna certificate huwezi kuingia Kenya, kama vile tu Mkenya haiwezi kuingia Uganda ama aingie Tanzania bila certificate. Lakini hiyo certificate lazima iwe ni certificate ya maana. Lazima it must be an authentic certificate. Huwezi kuingia kiosk ama clinic unapatiwa karatasi ambayo inasema uko COVID free na anafanya kastamp, anafanya kastamp Dogomano clinic kap analete kaboda. Hiyo jameni hiyo haiwezekani. Ni lazima tusikizane, lazima tupeane heshima. Uje na certificate ambayo it is certified from a WHO recognized lab. It is the only way that you can be certified. So because of these things that are going on, I really want to ask for cooperation between our drivers, particularly truck drivers. Tafadhalini, if you don't want us to have this problem you're having in Busia, please, tafadhalini, fuateni sheria. I had rather have people demonstrating in Mombasa because they can't be tested because of shortage of testing aids, testing kits, than have people in line up in the border posts. Pertaining to our COVID-19 situation today, 124 people have tested positive from 2,640 samples in the last 24 hours. Therefore, the total number of positive cases in Kenya now stands at 2,340, while the total number of samples tested so far is 87,698. The positive cases include 119 Kenyans, 2 Somalis, 2 Tanzanians, and 1 Eritrean national. These figures do not include the number of foreigners we have tested at the border and turned them back to their countries. Mombasa had the highest figures today, standing at 40, while Nairobi at 38, and now Busia at 26. You can see what I'm talking about. All these 26 people you are seeing here from Busia are essentially truck drivers who are being tested at that spot. Now, which then bears and brings a big problem for the Busia government, because it means you have to start quarantining, isolating people who are not necessarily from the Busia county. Kajiado, the same thing, with 6 of them again, and so on and so forth. Now, today, Elgeyo Marakwet becomes the latest county to report a COVID-19 case, bringing now the total number of counties that have been affected to 36 out of the 47. In Mombasa, the 40 cases that were there, out of the 40 cases, 14 of them are from Mvita. Again, the same thing. We have 14 from Kisauni and 11 from Changamwe. The same trend again in the same areas. In Nairobi, we have 38 cases from Kibera, 25 from Kamukunji, and 25 and the cases from Kibera, a lot of them are in the quarantine facilities. 25 from Kamukunji as well. I would also like to add that in terms of gender, again, 100 are male and 24 are female. We still have to come down and find out why over 70% of the infections are still in male and are still the male gender. In Garissa, the 2 cases that we got came from Dadaab, and while in Muranga, we have 1 case which is in Kiharu. Now when you start hearing of these rural areas, then you know that we really do have community infections. We are also happy today that we have discharged 39 patients from various health facilities, bringing our total number of recoveries to 592. We want to pray that we get more of those, and we want to completely support and thank our healthcare workers for the work that they continue to do to see that as many of our people as possible recover. Unfortunately, we have also today lost 4 patients to the disease, bringing the number of fatalities to 78. Our sincere condolences go to the families of those departed. Finally, I want to thank Kenyans who have taken the containment measures seriously and followed them strictly. I appeal to those who haven't joined us in this work to do so. I thank you.